When you're new to Medicare, there's a lot to learn. So here is the Senior LinkAge Line's Medicare Top 10 list of what you should know. Number 10. To enroll in Medicare, you must contact Social Security at age 65. That's right, if you are not collecting Social Security benefits at age 65 and you want to enroll in Medicare, you have to contact Social Security to get the party started. If you are collecting Social Security, your enrollment in Medicare will be automatic unless you decide to delay your enrollment in Medicare Part B because you will continue to work. Number 9. Know your Medicare Part A, B, and D initial enrollment periods. For most people, the initial enrollment period lasts for 7 months, starting 3 months before the month of your 65th birthday, including the month of your 65th birthday, and ending 3 months after. Number 8. Get informed about Medicare Part B and Part D late enrollment premium penalties. If you don't enroll in Medicare Parts B and D when first eligible, it can cost you later on, and no one likes wasting money. Unless you or your spouse are still working and have health insurance through that job, you must enroll in Part B as soon as you're eligible, or else pay a 10% higher premium penalty for every 12 months you wait. For Part D, the penalty is 1% for every month you wait, and these penalties never go away. Number 7. Understand your Medigap, Medicare Supplement, 6-month open enrollment period. Medigap is a private insurance policy that covers things not paid for by Medicare Parts A and B, like coinsurance, co-payments, and deductibles. Some policies also pay for care provided outside of the United States. Medicare supplemental policies do not have provider networks. So if you dream about spending winters on the sunny beaches of Florida, the last thing you want to worry about is whether there's a network provider in your area. If you are considering buying a Medigap policy, you need to know about your once-in-a-lifetime 6-month window of open enrollment. Once you enroll in Medicare Part B, you have 6 months to purchase a Medicare supplement without any health screenings. This means that within the 6 months, you cannot be denied the ability to purchase a policy because you have health conditions or problems. After the 6-month window, an insurance company can health screen you and refuse to sell you a policy. So beware and don't let the time fly by without making your decision. Number 6. Every year review your current Medicare choices from October 15th through December 7th. You've made your Medicare choices and you think you're set for life, right? Wrong. If you've enrolled in a Medicare Advantage, Medicare Cost, or Medicare Part D plan, it's important to understand that these plans can and do change from year to year. Providers can change, costs can change, drugs covered by your plan change. So to make sure that you're getting the most out of your Medicare plans and coverage, review your choices annually during open enrollment, which is from October 15th to December 7th. So mark your calendar now. Number 5, Medicare does not cover long-term care services. None of us want to think about getting older, but the truth is that as we age, the chances increase that we will need help with things like personal care, chore services, and transportation. Or maybe we'll need the kind of care provided in an assisted living or nursing home. Medicare does not pay for these kinds of care. So it's critical to plan ahead now for meeting your long-term care needs. Number 4, when in the hospital, ask if your stay is for observation. Sometimes the stay in the hospital is not an actual inpatient hospital stay. As strange as that sounds, observation stays in the hospital look like any other inpatient stay, with a hospital room, medications, medical tests, and nursing care. However, you are considered an outpatient if your status is listed as observation. Outpatient services are paid for by Medicare Part B and will cost you more money than if you had an inpatient hospital stay covered by Medicare Part A. Observation stays also have a big impact on Medicare coverage for skilled nursing home stays. In order to even be considered for Medicare coverage in a skilled nursing facility, you must have an inpatient hospital stay of at least 3 midnights. So lesson learned, when in the hospital, ask if you are an inpatient or under observation. If you're under observation, talk to your doctor about getting your status changed. Number 3, got gap coverage? Medicare does not cover complete annual physicals, hearing aids, dental care, dentures, eyeglasses, or acupuncture. And for those services that Medicare does cover, there's often a copay or coinsurance. Coverage for some of these gaps can come from a Medigap policy, a Medicare cost plan, or a Medicare Advantage plan. Check with your policy or plan to see if you have coverage that can help fill these gaps. Number 2, if you have Medicare, you do not need MNsure. MNsure is Minnesota's health insurance marketplace where individuals, families, and small businesses can compare and buy health insurance coverage. Once you are eligible, Medicare takes care of your insurance needs, so MNsure is not needed. If you currently get your health insurance coverage through MNsure, but will soon be eligible for Medicare, call the Senior LinkAge Line to understand the steps you need to take to have the correct insurance. Some people with Medicare need help paying their health care costs. While financial aid is not available through MNsure, there are other programs available to help you if you qualify. If you're having trouble with Medicare costs, the experts at the Senior LinkAge Line can help explain what programs are available, how to apply, and even help you complete an application. And the number one thing to know is get help from your Medicare experts at the Senior LinkAge Line. Senior LinkAge Line is a state service providing free, comprehensive, and unbiased Medicare assistance. Local experts are ready to answer your questions and guide you through the maze of Medicare. Call 1-800-333-2433 or visit minnesotahelp.info for a live chat. The Senior LinkAge Line offers free classes in your area to help you understand the basics of Medicare and stay on top of changes that happen each year. Want to start learning about Medicare on your own? Visit the Senior LinkAge Line website or call the Senior LinkAge Line for a free copy of the Minnesota Board on Aging's publication, Healthcare Choices for Minnesotans on Medicare. Find out the basics of Medicare and see what plans are available to you in Minnesota.